Carol, you're not usually shy in letting Commonwealth authorities know when they're doing the wrong thing, as I know from my time at TGA. And I've sat, Tony, at the other end of the panel for good reasons. What's missing from what IPA's doing? What haven't they done, and what do they need to do? And Tony, why haven't you done it, and are you going to do it?
Let him start first.
No, I think I should start first. I think we may well have had some of these discussions, and certainly the consultants that came to see us, we were very frank with about where we see this going. And I think, I guess there's a lot to be done, and from our perspective, we're at a starting point. It's a good thing to aim for, to get a more efficient system in place. And I think, most consumers recognise that, there's limited dollars and they have to be spent well and efficiently, and that, we can't just continue to increase the size of the pie, that we have to actually rationalise. But to me, it is the most critical part of this whole thing is making sure that we match up we're paying for the best quality service. So we have to get that data and those quality drivers of performance. We need to look at consumers' experience of their healthcare, we need to look at the health outcomes, and we need to pay for performance based on those things, because ultimately the health system is meant to be for consumers. So I think matching up the data, and there's very good data around, certainly the Australian Commission on Quality and Safety in Healthcare has produced a number of key questions that look very specifically at some of the outcome measures that we should be aiming for. We've suggested that we would like to see those factors included in the pricing model and used as the cornerstone for placing a value on the cost of healthcare. So I think once we get those things matched up, and as Tony said, you're moving towards a normative-based pricing model, that's what we'd like to see ultimately, and we see this as a very first step towards, really driving quality performance in the system that better meets the needs of consumers.
So that was much politer than TGA. Tony?
I don't think there's any disagreement between Consumers Health Forum and IPA that we need to develop a more patient-focused pricing system. Our data is actually patient-level data at the moment, which is pretty good for an international comparison. If you look around the world, we're one of the few jurisdictions, a few countries that can actually do that. But having said that, we do recognise there's a long way to go in terms of developing a more strategic pricing regime that drives not only an efficient outcome, but as Terry Clout said, a more effective and appropriate outcome. Having said that, there's a lot to be gained for consumers in an efficient outcome. It does free up funds for more consumers to be cared for, and it does highlight a lot of issues in the system that we can work on together. That all of us know it. If we work in an individual hospital, we all know the inefficiencies it created. But when you present them at aggregate level, at a national level, it allows us to take that anecdotal experience into the policy realm and makes a discussion with governments a lot more evidence-based and a lot clearer about what governments can do to fix problems in our system. So, and that eventually flows through to a better system for the consumer. So I don't think there's any disagreement. We're looking forward. CHF are on our Stakeholder Advisory Committee, and we will be working with them and a range of other clinical and other stakeholders to improve our system.